questioning and recognize myself for 5 minutes. Dr. Mazonik, as you discussed in your testimony, hospital cybersecurity incidents are particularly expensive and can lead to tremendous patient impacts, such as the temporary cancellation of elective procedures and patient diversion to nearby hospitals when there are nearby hospitals. In some of the rural areas, they aren't there, much more difficult. Given these potentially devastating effects, could you give a broad example of what the Administration for Strategic Preparedness and Response does to mitigate a cyber attack when they first hear of it?
Thank you, Mr. Chairman. That's an excellent question. As you noted in your question, I think part of the challenge we face with the healthcare and public health sector is the complexity of the sector itself. It's incredibly diverse. You have large hospital systems, you have small rural hospitals, very different resource allocations to address the growing and pervasive cyber threat that exists. One of the things that we're doing, I mentioned in my opening statement, in terms of developing resources, we tailor those and try to make them as accessible as possible, particularly for those under-resourced or smaller hospitals. So the HICCUP, the Health Industry Cybersecurity Practices Guide that we recently updated, has essentially bifurcated sections that focus and have resources ready to go off the shelf for small hospitals, as well as resources tailored to the larger elements of the sector. But this is something that we need to continue to stay abreast of and focus on, and we're actively working with our partners in the sector to understand their needs, and we'll continue to provide tailored resources as best we can.
Thank you very much, Dr. Travers. The water and wastewater sector relies on a stable energy supply to power water utilities. Given this interdependence, how does the EPA coordinate with the Department of Energy to prepare for a cyber incident that interrupts the supply of energy to a water system?
Thank you for the question, Chairman Griffith. Each of us on the panel today, I think, represents a sector critical to this nation. I'm not sure what community could function without power, water, and adequate health care. We engage extensively with other sector risk management agencies, including the Department of Energy and Health and Human Services. So an example of that coordination, since you asked specifically about energy, we have activities relevant to the Department of Energy where we developed a power resilience guide, which enables water systems to build redundancy, understand the countermeasures that are available to them to enhance their resilience if the power should go out, whether because of a cyber attack or because of a natural disaster. We also host training of both power sector entities and water systems so that each can understand the dependence of one on the other. As you implied in your question, water systems cannot function generally without a supply of electricity. It's critical for the treatment of water, distribution of water, storage of water, virtually every facet of producing and delivering water systems. But because of these robust engagements with both DOE, with entities within the energy sector and with entities within the water sector, I believe we have cultivated a robust level of coordination among our respective sectors.
Thank you. Mr. Kumar, Colonial Pipeline of May 2021 obviously caused a great deal of disruption. How did the department's knowledge of and pre-existing relationship within the oil and gas sector prepare it to assist with a federal response?
Chairman, thank you for the question. When it came to Colonial, when you're responding to an incident, that relationship isn't developed during an incident. It's developed during blue sky days, as we call it. We've had a long-standing relationship with Colonial because of natural hazards, because of hurricanes, and other climate-based risks that we were working with them on long before the cyber incident. And so when Colonial happened, we were one of their first calls. They called us and said, hey, we just had this cyber incident, and we think we have to turn off the pipeline. And so we were able to immediately get into gear and work with them to understand what is going to be the potential impact of fuel supply, but also the cyber side. So it really ended up being two incidents. One was the cyber side, in terms of these cyber actors potentially on their networks. The other part that we were concerned about was the consequence of a pipeline, a critical pipeline, being down. And so we were able to not only leverage our own expertise across the department, across department offices such as our Office of Fossil Energy, but also the national laboratories to really come and support them. And we brought along the entire whole of government approach. So we brought DHS, the FBI, and other agencies to ensure Colonial had the support they needed. I was on daily calls with Colonial's CEO. And so this is really important. We need to have those relationships with the sector well before an incident, whether it's a cyber attack or a physical incident, to be able to carry out our responsibilities.
And help me with my recollection, did you all coordinate with the other suppliers in the areas close by to try to increase their supply, or was that another agency?
Absolutely, sir. We work with all of those suppliers to make sure. We also work with the states because the states need to be prepared. So we had to work with everyone.
Thank you very much. I appreciate it. I yield back and now recognize the gentlelady